Waking up at night again and again, feeling discomfort in the body, or noticing small changes that seem harmless on their own, can often be the earliest way the kidneys try to ask for help, especially after the age of 50, when kidney function naturally becomes more sensitive to changes in blood pressure, hydration balance, and circulation. Yet the problem is that these signals are almost always quiet, gradual, and easy to ignore, which is why many people only realize something is wrong when the condition has already progressed, and doctors often emphasize that the kidneys are silent organs that rarely cause strong pain even when they are under serious stress, meaning that the warning signs usually appear indirectly, especially during the night when the body is resting and subtle imbalances become more noticeable. And one of the first nighttime signs that is commonly overlooked is frequent urination during sleep, where a person wakes up multiple times during the night needing to pass, urine even if they have not consumed excess fluids in the evening. And this can happen because the kidneys are no longer able to properly concentrate urine or manage fluid balance efficiently, causing the body to release more fluid during nighttime hours instead of maintaining a steady balance. And while many people assume this is just a normal part of aging or a weak bladder, medical experts often warn that persistent nighttime urination can be an early sign that kidney filtration is becoming less effective, especially when it is paired with tiredness in the morning or disrupted sleep patterns. And another important nighttime symptom is swelling in the legs, ankles, or feet that becomes more noticeable at night or after lying down for a while. Because when the kidneys are not filtering excess fluid properly, that fluid can accumulate in the lower parts of the body due to gravity and reduce circulation during rest, creating a feeling of heaviness, tightness, or puffiness that may be more visible when waking up or getting out of bed. And doctors often warn that this type of swelling should not be dismissed as simple fatigue or long-standing hours, especially when it appears regularly, because it reflects an imbalance in how the body is managing fluids. And this imbalance is often linked to early kidney stress or reduced filtration capacity. And as the condition continues, another nighttime sign may appear in the form of restless sleep or frequent waking without a clear reason, where the body feels uncomfortable, unsettled, or unable to stay in deep sleep. And some medical researchers suggest that when kidneys are not properly filtering waste products from the blood, those toxins can slowly build up and affect the nervous system, leading to disrupted sleep patterns, difficulty staying asleep, or waking up feeling unrefreshed even after enough hours in bed. And this poor sleep quality can gradually affect energy levels during the day, making the body weaker over time, and adding further stress to already struggling kidneys. And another subtle but important nighttime warning sign is persistent itching or dry skin that becomes more noticeable at night, especially when lying still in bed. And this can happen because when kidney function declines, waste products and mineral imbalances in the blood may begin to affect the skin and nerve endings, leading to itching sensations that do not have an obvious external cause like allergies or skin conditions. And many people mistakenly assume this is due to dry weather or bedding. But doctors often note that unexplained nighttime itching in older adults can sometimes be linked to internal kidney strain, especially when it continues over time without relief from normal skin treatments. And finally, another serious nighttime symptom that should never be ignored is difficulty breathing comfortably while lying down, where a person may feel the need to sit up to breathe more easily or experience a sense of pressure in the chest or lungs during rest. And this can occur when excess fluid builds up in the body due to reduced kidney function, making it harder for the lungs to expand fully during sleep. And medical studies show that this type of breathing difficulty at night may be connected not only to kidney issues, but also to fluid imbalance affecting the heart and circulatory system, which is why it is considered a serious warning sign that requires attention. And when all of these nighttime symptoms are viewed together, frequent urination, swelling in the lower body, restless sleep, unexplained itching, and breathing difficulty while lying down, they form a pattern that should not be ignored because each one represents a different way the kidneys may be struggling to maintain balance inside the body. And the most important concern is not just the presence of one symptom, but the repetition and combination of these signs over time, because kidneys rarely fail suddenly without warning. Instead, they gradually lose efficiency while quietly sending signals during rest periods like nighttime. And understanding these signals early can make a significant difference, because when kidney problems are detected at an early stage, lifestyle changes, hydration control, blood pressure management, and medical treatment can often slow down progression and protect long-term function. But when ignored for too long, the damage becomes harder to reverse and can eventually affect overall health, energy, and quality of life. Which is why paying attention to what happens during the night is so important, because the body is often most honest in its quietest moments, and listening carefully to these small changes can help protect kidney health before more serious complications develop, allowing a person to maintain strength, stability, and independence for much longer. It is also important to understand that kidney-related nighttime signs rarely appear in isolation, meaning they often develop alongside other subtle changes in the body that may not seem connected at first, but are actually part of the same underlying imbalance. And this is why doctors encourage looking at the full picture rather than focusing on a single symptom, because the kidneys are deeply connected to the heart, blood vessels, liver, and even the nervous system. And when their function begins to slow down, it can create a chain reaction that affects multiple systems at once, especially during the night when the body is supposed to be in its most stable and restorative state. And one of the most overlooked aspects of this condition is how gradually it develops, because in many cases the body adapts to reduce kidney efficiency over time, which means the early warning signs feel mild and easy to ignore, such as slightly more frequent urination at night, a bit of puffiness in the ankles, or occasional restlessness during sleep. But what makes this dangerous is that adaptation does not mean healing. It only means the body is compensating, and while compensation can temporarily maintain normal appearance, it does not stop the underlying decline. And this is why nighttime symptoms become so valuable for early detection, because they often appear before daytime symptoms become obvious, giving a critical opportunity to identify kidney stress at a stage where intervention is still effective. And another important point to understand is that kidney function naturally declines with age, but not at the same rate for everyone. And factors such as high blood pressure, diabetes, excessive salt intake, dehydration, long-term medication use, and sedentary lifestyle can significantly accelerate this decline, making nighttime symptoms more likely and more noticeable in some individuals. And this is why medical experts emphasize regular monitoring and awareness, especially after 50, because early kidney changes often do not cause pain, and pain is usually what alerts people to health problems. But in kidney conditions, waiting for pain often means waiting too long, and by that stage, significant damage may already be present. And this is why attention to sleep-related changes is so important, because sleep is when the body reveals imbalances that are hidden during daytime activity. And if a person consistently wakes up tired, swollen, restless, or uncomfortable without a clear explanation, it should not be dismissed as normal aging or poor sleep quality alone, because these signs may be reflecting deeper internal stress, and the kidneys are often central to that process. And recognizing this connection early allows for medical evaluation that can include simple tests like blood creatinine levels, urine analysis, and blood pressure monitoring, which can provide clear insight into kidney health before symptoms become severe. And when identified early, many kidney-related issues can be managed effectively through hydration adjustments, dietary changes, medication control, and lifestyle improvements, which can significantly slow progression and preserve function. But when ignored, these silent signals may continue to worsen gradually until they begin affecting daily life, energy levels, and overall well-being, which is why understanding and respecting nighttime warning signs is not about fear, but about awareness and prevention. Because the earlier these changes are noticed, the greater the chance of protecting long-term kidney health and maintaining a stable, active, and independent life even in older age. These nighttime kidney warning signs, it becomes clear that one of the biggest dangers is not the symptoms themselves, but the way they are mentally interpreted, because many people over 50 tend to normalize discomfort, especially when it develops slowly, and this normalization creates a delay in action that can allow kidney problems to progress quietly for months or even years. And doctors often stress that kidney disease is one of the most silent conditions in medicine, meaning that by the time clear symptoms appear during the day, a significant portion of kidney function may already be affected, which is why nighttime signals deserve special attention, because they are often the earliest visible clues that something is changing internally. And another important factor is how easily these signs are confused with other common conditions. such as aging bladder changes, joint stiffness, poor sleep habits, or general fatigue. And while these explanations may sometimes be true, the risk comes when they are assumed without proper medical evaluation, especially when multiple symptoms appear together, such as waking up repeatedly at night, swelling in the lower legs, persistent itching, difficulty staying asleep, or feeling short of breath when lying flat. Because when these signs cluster, they often indicate that the body is struggling with fluid balance and waste removal, both of which are core functions of the kidneys. And medical research consistently shows that early detection of kidney dysfunction significantly improves long-term outcomes, especially when lifestyle changes are introduced at the right time. And this can include simple but effective adjustments such as controlling salt intake, maintaining proper hydration throughout the day, managing blood pressure carefully, avoiding unnecessary medications that stress the kidneys, and ensuring regular physical activity to support circulation, because all of these factors directly influence how efficiently the kidneys are able to filter blood and maintain balance during both day and night. And what is especially important is that kidney stress does not always show dramatic symptoms. Instead, it often shows patterns, and nighttime is one of the clearest times where those patterns become visible, because the body is not distracted by movement, eating, or activity, and instead is focused on rest and internal regulation, which makes any imbalance more noticeable. And this is why doctors often encourage paying attention to how the body behaves during sleep, not just during the day, because sleep quality, nighttime urination frequency, swelling after lying down, and breathing comfort are all indirect indicators of internal organ health. And when these indicators begin to change, even slightly, it is often a sign that the kidneys are under increased pressure. And while this does not always mean severe disease is present, it does mean that the system is no longer functioning as smoothly as before. An early recognition at this stage can make a significant difference in preventing progression, because kidney function cannot be fully restored once severely damaged, but it can often be preserved and stabilized when addressed early. And this is why awareness of nighttime symptoms is not just helpful information, but a practical tool for protecting long-term health, independence, and quality of life, especially for older adults who may already be managing other health conditions that indirectly affect kidney function. And ultimately, the goal is not to create worry about sleep or nighttime changes, but to encourage careful observation of the body's natural signals, because in many cases, the earliest warning signs of kidney stress are not loud or painful. They are quiet, repetitive, and easy to overlook, yet they carry valuable information that can help prevent more serious complications if recognized in time. It is also essential to understand that kidney health is closely tied to overall circulation and heart performance, which means that when nighttime symptoms begin to appear, they are often not isolated kidney issues alone, but part of a broader imbalance in how the body is managing blood flow and fluid distribution. And this is why doctors often look at kidney-related complaints together with blood pressure patterns, heart strain, and metabolic conditions like diabetes, because these systems constantly influence each other. And when one becomes weaker, the others are forced to compensate. And this compensation is often what creates subtle nighttime symptoms, such as waking frequently to urinate, feeling restless in bed, noticing puffiness in the feet, or experiencing discomfort when lying flat. And what makes this especially important is that these changes do not always feel alarming in the beginning. Instead, they feel like minor inconveniences that are easy to adjust to. But the body has a way of gradually normalizing dysfunction, which is why many people do not realize how significant these early changes are until the condition has already progressed. And this is why awareness becomes a protective tool, because when you understand that these nighttime patterns are not random, you begin to observe them differently. And observation leads to earlier action, and earlier action leads to better outcomes, especially in kidney-related conditions where early intervention can significantly slow progression and preserve function. And another key point that medical professionals emphasize is that kidney symptoms rarely come with strong pain signals, unlike other organs, which makes them more dangerous in a way because pain usually forces people to seek help. But kidneys often fail silently without creating urgency until damage becomes more advanced. And this is why nighttime signs such as repeated waking, swelling, itching, fatigue, or breathing discomfort should never be ignored simply because they are not painful, because seriousness in medicine is not always measured by pain intensity, but by the function of the organ involved, and the kidneys are responsible for filtering toxins, balancing electrolytes, regulating blood pressure, and maintaining fluid stability, meaning that even small disruptions can affect the entire body over time. And when these disruptions are first noticed at night, it is often because the body is in a resting state where internal regulation becomes more sensitive, and any imbalance becomes more visible. And this is also why doctors encourage routine checkups even when symptoms feel mild, because simple urine tests and blood tests can detect early kidney stress long before it becomes severe, allowing for timely lifestyle changes and medical support. And in many cases, patients who respond early to these warning signs are able to maintain stable kidney function for many years without major complications, which highlights the importance of not delaying evaluation, even when symptoms seem minor or inconsistent. And ultimately, understanding these nighttime signals is about building awareness of how the body communicates under stress, because the kidneys often speak quietly but consistently. And those quiet signals, especially at night, are often the first opportunity to prevent a much larger health problem from developing in the future. It becomes even more important to recognize that kidney-related nighttime symptoms should always be evaluated in context, meaning that a single sign may not always indicate serious disease, but a pattern of repeated changes over time is what usually raises concern in medical practice. And this is especially true for older adults, where natural aging processes can sometimes mimic early disease symptoms, making it harder to distinguish between normal changes and early warning signs, which is why careful attention to frequency, intensity, and combination of symptoms is so important because, for example, waking up once at night may not be unusual, but consistently waking multiple times to urinate, combined with swelling in the legs, fatigue in the morning, or difficulty staying asleep, begins to form a pattern that deserves medical attention, and similarly, mild dryness of skin. Once in a while may not be significant, but persistent itching that worsens at night, especially without any clear external cause, may suggest internal imbalance related to waste buildup or mineral disruption. And when these signs appear alongside changes in breathing comfort or energy levels, the likelihood of an underlying kidney-related issue becomes more relevant. And this is why medical professionals often focus on clusters of symptoms rather than isolated complaints, because clusters provide stronger evidence of systemic imbalance. And kidney dysfunction is one of those conditions that gradually affects multiple systems at the same time, including fluid regulation, nerve sensitivity, and cardiovascular stability, which is why nighttime symptoms can appear in different forms across different individuals, yet still point toward the same underlying issue. And another important aspect is how sleep quality itself becomes a reflection of internal health, because the kidneys play a role in maintaining chemical balance in the blood. And when this balance is disrupted, it can affect how deeply and consistently a person sleeps, leading to frequent awakenings, restlessness, or feeling unrefreshed in the morning, even after a full night in bed. And over time, this poor sleep can contribute to fatigue, reduced physical activity, and increased strain on the body, creating a cycle that further affects kidney function. And this is why early recognition is so important, because breaking this cycle at an early stage can significantly improve long-term outcomes, especially when combined with medical guidance and lifestyle adjustments. And doctors often emphasize that kidney protection is not only about treating disease, but about maintaining stability in daily habits, such as staying properly hydrated during the day, reducing excess salt intake, managing blood pressure, and avoiding unnecessary strain on the kidneys from medications or unhealthy routines. And when these protective measures are introduced early, they can significantly reduce the progression of kidney-related problems, even when early symptoms have already appeared. And ultimately, the key message remains that nighttime is one of the most sensitive periods for detecting early kidney stress, because it removes distractions and reveals subtle changes in the body's internal balance. And by paying attention to these changes instead of ignoring them, it becomes possible to take timely action, protect kidney function, and maintain better long-term health, energy, and independence.